friends, hope you all doing well. So today here in this video I will discuss about palatine tonsil. Palatine. So tonsil. In this video I will discuss about palatine tonsils. At first I'll tell you what is palatine tonsils, then the different uh, features of palatine tonsils, then the arterial supply of palatine tonsil, then the venous drainage, lymphatic drainage and nerve supply, and also the clinical and the applied anatomy of the palatine tonsil. So at first let's start. This is the palatine tonsils. It has two palatine tonsils in our body. So palatine tonsil, it's a collection of lymphoid tissue. It's a collection of lymphoid tissue. So palatine tonsil is a collection of lymphoid tissue, and it is situated on the tonsillar fossa. It's situated on the tonsillar fossa. So this is palatine tonsil. This is a vein. This is its name. This is a veins name, paratonsillar vein. Then these are called infratonsillar cleft. These clefts are called infratonsillar cleft. Then these are the capsules, and it has three layers. First layers in the inner part, this is called pharyngovasal fascia. Then the second layer, this is superior constrictor muscles. This layer is superior constrictor muscles layer. And the third layer, it is the buccopharyngeal fascia. Then the second layer is the superior constrictor muscles, and the third layer, it is pharyngovasal fascia. So these are the different parts of the palatine tonsil. So palatine tonsil is a collection of lymphoid tissues, and it's situated on the tonsillar fossa, one on each side. In the lateral wall of oropharynx, tonsillar fossa it's a triangular fossa. It's a triangular fossa, and it has the following features. Number one, we'll discuss about the anterior wall. Of the palatine tonsil. So the anterior wall of the palatine tonsil is formed by the palatoglossal arc. Palatoglossal arc. So the anterior wall of the palatine tonsil is formed by the palatoglossal arc. And the number two, posterior wall. So anterior wall is formed by the palatoglossal arc. The posterior wall is formed by the palatopharyngeal arc. This is palatopharyngeal arc. Posterior wall is formed by the palatopharyngeal arc. This is anterior wall, palatoglossal arc. And the apex, number three, that is apex. Apex of the tonsillar fossa of the palatine tonsil is formed by the meeting of the both arcs. Both arcs means this is the palatoglossal and the palatopharyngeal arc. So this is the meeting of the both arc. Is formed, the apex is formed by the meeting of the both arc, that is palatoglossal and the palatopharyngeal arc. Okay, so now the base. Apex is formed by the uh, meeting. Number 4, that is base. So base of the palatine tonsil is formed by the dorsal surface of the posterior one third of the tongue. Posterior one third. Of base of the palatine tonsil is formed by the posterior one third of the dorsal surface of the posterior one third of the tongue. So the tonsillar bed or the floor of the tonsil. Now the tonsillar bed. Tonsillar bed is formed by the number 5. Tonsillar bed. Tonsillar bed is formed by the tonsillar bed or the floor of the tonsil is formed by the superior constrictor and the partly by the palato superior constrictor and palatopharyngealis muscles. Superior constrictor muscles is formed by the superior constrictor and partly by the palatopharyngeal muscles. Palatopharyngeal muscles. So this is the tonsillar bed, and now I will discuss about the arterial supply of the tonsil. Arterial supply. Now the arterial supply of the artery supply. So tonsillar is rich. It's a rich hair has a rich supply of blood, which are derived from the number 1, that is tonsillar branch of facial artery. So I will draw here the different arteries. Arterial supply of the palatine tonsil. So the arterial supply of the tonsil. So these are the different artery which supply the palatine tonsil. So number 1, that is tonsillar branch of facial artery. Tonsillar hello. So the different arteries of the palatine tonsil which supply the tonsils, they are number 1, that is tonsillar branch of facial artery. Tonsillar branch of facial artery. Tonsillar branch of facial artery. This is the facial artery. Okay, here is the supply. This is facial artery. This one numbering 1. So this is the facial artery. Number 2, that is tonsillar branch of facial artery. It is the principal artery. Here you can see this is the principal artery of tonsil, and it enters the glands via its lower pole. Number 2, that is dorsalis lingual artery, branch of the lingual artery. Dorsalis lingual artery. This is the lower pole. Number 3, 2, dorsalis lingual artery. artery, lingual artery. Dorsalis lingual artery, which is the branch of lingual artery. This is the branch of lingual artery. Branch of lingual artery. So this is this one. Okay. Number 3, that is ascending palatine artery. Number 3, ascending palatine artery. Okay. Number 3, ascending palatine artery. Ascending palatine artery, this one is ascending palatine artery. Here, this is the I have told you tonsillar branch of the facial artery. This is palatine ascending palatine artery. This one. Number 3, ascending palatine artery. This artery is ascending palatine in the lower part is facial. It's the facial artery, tonsillar branch of facial artery. In the upper part, this one is the number 3, ascending palatine artery. And number 4, ascending pharyngeal artery. And greater palatine artery. Ascending pharyngeal. Number 4, ascending pharyngeal artery. Ascending pharyngeal artery. And number 5, that is greater palatine artery. This is the greater palatine artery. Number 5, greater palatine artery. Greater palatine artery. So this is the 5th branch, which is the branch of the maxillary artery, and the ascending pharyngeal artery, it is the branch of external carotid artery. And number 3, that is ascending palatine artery, which is the branch of facial artery. This is also the branch of facial artery. Here is the facial artery. It is also the branch of the facial artery. Here is the number 3, ascending palatine artery. It is the facial artery, and the branch of this artery is ascending palatine artery. And this is the tonsillar branch of facial artery. And number 1, that is tonsillar branch of facial artery, and that's also a branch of the facial artery. So this was the arterial supply of the tonsil. Now I'll discuss about the venous drainage of the tonsil. So now the venous drainage. So venous drainage. So vein drains into the pharyngeal plexus veins through the veins drains into the pharyngeal 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 plexus of veins through the paratonsillar vein. Okay, so venous drains into the pharyngeal plexus of veins through the paratonsillar vein. Now the lymphatic drainage. Now the lymphatic drainage. Lymphatics from the tonsil drains into the jugulo-digastric lymph nodes. Jugulo-digestive lymph node, it's often called the tonsillar lymph node. and it's usually enlarged in the infections of the tonsil, which is called tonsillitis. Jugular-digestive lymph node. So now the nerve supply. So now the nerve supply. So nerve supply is, it's supplied by the tonsils are supplied by the glossopharyngeal of the respective side, glossopharyngeal nerve, by the glossopharyngeal. Glossopharyngeal nerve from the respective site. Okay, now the clinical aspect. So clinical aspect, you have heard that the in children up to puberty and atrophy by the adulthood, they are known to infectious increase in size in children in the childhood due to the repeated infection causing tonsillitis, which is treated by antibiotics. So tonsillitis is the clinical impaired tonsillitis. It's caused by the repeated infections in the tonsil, and then it increases in size. It's mainly happen in the cause in the children up to puberty, and it's treated by the antibiotics. So number 2, that is tonsillectomy. So tonsillectomy is the surgical removal of the tonsil. It's necessary if they become a site of repeated infections. If this tonsils may be a site of the repeated infections, so and repeated infections, or there is a tonsillar abscess, or there is a tonsillar abscess, or they enlarge so much that they block the passage to blow, or they enlarge too much that they block the passage. So it's very necessary to remove the tonsil, that is called tonsillectomy. And injury to the paratonsillar vein during surgical is an important cause of hemorrhage. It's an important cause of hemorrhage. This is usually controlled by applying pressure. So this was the applied anatomy of clinical aspect, or the applied anatomy of the tonsil, that is tonsillitis and the tonsillectomy. Tonsillitis, that means the repeated infection in the tonsil. It's caused mainly in the children up to puberty, and it's treatment done by treated by antibiotics. Then the tonsillectomy, that is the removal of tonsil, when it became the place where repeated infection cause, and sometimes it enlarge in size, and so it block the passage, block the path, so it should be removed. So thank you for watching this video, and please subscribe this channel if you like this video. Thank you.